Welcome back. We've been discussing the dramatic mystery illness striking a group of young teen girls from the same school. It's mysterious in that some of these girls went to lie down for a nap and woke up with a severe Tourette's-like tics and twitches and stuttering, verbal outburst. Back with me is Dr. John Sharpe, a psychiatrist who's also a faculty member at Harvard Medical School. We have now Dr. Rosario Trifoletti, a pediatric neurologist who is heading to Leroy, New York this weekend to meet with some of the girls and their parents. And two physicians that have treated 10 of the girls, neurologist and vice president of the Dent Neurological Institute, Dr. Laszlo Mettler, and Dr. Jennifer McVig, a pediatric neurologist who works with Dr. Mettler. Now, both have diagnosed some of these girls with conversion. Let's clarify what that is so people get a sense of what this is. And I hope this is as interesting to my viewers as it is to us, and how much we want to stay on top of this until we have full resolution for everybody. Now, according to the Mayo Clinic, conversion disorder is, quote, a condition which you show psychological stress in physical ways. The condition was so named to describe a health problem that starts as a mental or emotional crisis, a scary or stressful incident of some kind, and converts to a physical problem. Symptoms include, and this is what you pay attention to, poor coordination or balance, paralysis in arm or leg, inability to speak, vision problems including blindness, and seizures or so-called convulsions. Dr. Mettler, on what do we base the fact that your opinion is these are conversions?
Well, we had the opportunity to see the first patient that showed up in October. At that point, Dr. McVig and myself, we evaluated the individual, and based on our neurologic examination, the way we examined the patient, and the history we took, we felt that that individual had conversion disorder. What shocked us was that in the following 2-3 months, then further patients started showing up to our office after being evaluated in the region. And then at that time, our diagnosis changed from conversion disorder to mass psychogenic illness.
Is it possible, as is sometimes the case, that case 0 or case 1 is a biological condition that sort of gets clouded by all the conversion?
Yes, that's so-called index case. So the reality is there a patient among this 12, and let me just expand, actually 15 cases now, because we've had 2 new patients show up to an office in the last 5 days. Is there a patient among those 15 that may have a tic disorder, a movement disorder, and then unfortunately the rest is just evolved from there? So we're not sure because we haven't seen all the patients.
Okay. Now, in the last segment, I mentioned this thing called PANDA syndrome, and I want to just point out what it stands for. It's an acronym for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. That's quite a mouthful. It's according to the National Institute of Health. It's a term used to describe a subset of children who have obsessive-compulsive disorder and/or tic disorder, such as Tourette syndrome, and in whom symptoms worsen following strep infections, such as strep throat or scarlet fever. In the old days, they called this St. Vitus Dance or Sydenham's chorea. It classically is sort of what we call a chorioathetoid movement, kind of like this. We don't see it anymore because strep infections, well, we don't identify it as frequently anymore because strep infections are so well treated with antibiotics. Dr. Trifoletti, you think this may be a diagnosis of PANDA in at least some of these cases?
That's right, and in fact, the idea of PANDAS has actually changed over the years. When initially defined in the mid-90s, it was very similar to what you were describing on the slide there, where it followed a streptococcal infection. That was necessary to define the illness. But as time has gone on over the last 10 years or so, we've come to appreciate that this illness can be associated with a number of other infections. And in fact, the name of the illness has been changed to something called PANS, or PANS, Pediatric Acute Neuropsychiatric Syndrome. They've taken the strep out of the name of the illness. And this, in fact, was done at a National Institutes of Mental Health conference that was held in July of 2010. That I attended along with 20 or so other physicians that were very interested in this condition.
Dr. Trifoletti, I'm going to interrupt you, if you don't mind. And you're on the record and somewhere out in the media are quoted as saying that you think the conversion diagnosis is, I think the quote was garbage. Can you address that?
Yes. I think it's, I think what I meant by there is that it's a diagnosis of exclusion. And
okay.
That is a, yeah.
Okay, and we all agree on that. That's Dr. Sharpe and I. Dr. Sharpe, you and I have been talking about that since we started this thing. Is that every stone must be overturned, especially guys. I'm talking to my whole team here on the window. We have a mom and some parents that are super duper motivated to look into every possibility. Dr. Sharpe, my understanding is you have some other resources out there you've offered them as sort of a second opinion if they wish. Is that accurate?
Completely right, Drew. What we're doing is trying to just support the treatment that the girls are getting. So obviously they're getting great care at Dent. Obviously they live between Buffalo and Rochester. Obviously Rochester is another great resource. I talked to Dr. Mettler today about the possibility of the girls getting care there. You know, Rochester is a medical center where they pioneered something called the biopsychosocial model, which is a whole approach to the patient, looking at every avenue, biological, psychological, and social. It's right down the road. So the girls can get coordinated backup care there, a consultation. Dr. Mettler knows about how to work that into his care practice. That's the best thing I can think of. And if I can make one more quick point.
Now, CNN,
conversion,
I'm going to interrupt you and tell you.
Sure.
CNN talked to both Thea Sanchez and Lydia Phillips last week, and this is what they had to say about the illness.
It's very heartbreaking to me, to be honest. I am knowing that right now I can't do what I love.
Last time I went to the neurologist, they said that they're not sure and that they'll keep looking into it. But besides that, they haven't told anyone anything.
I don't think this is in my head. I don't think I can wake up from a nap and this just happened.
Dr. McVig, I understand you haven't treated Thea Sanchez, but she and her mother both suspect this. They believe somehow this is not a conversion reaction. What are your thoughts on this?
I've been working with these girls for a long period of time, since the beginning of October, and the girls have had symptoms since, some of the girls since the middle of the summer. You know, it is a diagnosis of exclusion, and I've worked very hard with the families to explain how we go about finding that through laboratory studies. I've done MRIs on the girls, EEGs on some of the girls, EKGs. And not only are there these movement disorders, but some of the girls have fainting spells or syncopal episodes as well. There have been some seizures that we've had an EEG going during, and it's not actually an epileptic event, or there's no signs of an actual seizure on the EEG.
Okay, so that is what we call fictitious.
Many things.
Fictitious seizures, we call it factitious seizures.
Yeah.
Right, non-epileptic seizures, right. Dr. Flay, I've got less than a minute here, but this is a hard thing to nail down, the PNS syndrome, and it is something that's hard to treat. There's not a lot you can do. I've got 30 seconds. Tell